Hi everyone, welcome to Self-Balance Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Now, today's topic, we're going to talk about fibroids. We're going to talk about what are fibroids and what cause fibroids, as well as who is at risk for fibroids. Then the last, another thing that we're going to talk about is what are the symptoms of fibroids. And the last thing we're going to talk about is what acupuncture point or acupressure point for fibroids. That's it. So about 5 topics, right? 5 contents in it. Now the first thing is what are fibroids? Now I'm going to do something first, okay? I'm going to share, go to my Facebook and share, and I would like you to do the same if you're on Facebook right now. So give me a thumbs up first, and yeah, hello, Nuju on Instagram. Thank you. So can you share on Instagram? If you can, please share. Thank you. Hello. Now I'm going to my Facebook right now. I'm trying to share on to other posts. Okay. Now if you're on YouTube right now, I can see you. Say hello to me. Oh, there's a light that's going on. Oh, the light bulb is gone. So you will see but darker than me. So let me try. Okay, let's make it a bit bright. Okay, let's have a look. What can I do with this sharing? So I'm going to share. So take your friend in if you can. So let them know that you're watching a live video right now. So get them to come in. So we talk about fibroids today. Hi Johnson, how are you? So what can I do? So I'm going to share on our group as well. If you can share on a group, I'm going to share on the fertility page as well. I have a fertility page. I'm going to share on the fertility page because that is, when we talk about fibroids, one of the reasons for infertility is actually fibroids. So it's important. It's very, very important. We're going to talk about center of balance group. Okay, I'm going to post on my group as well. That is great. I'm going to share on. So I'm sharing at the moment on my Facebook. Please, can you do the same, please? Okay, that's it. Then I'm going to press watch. Okay, now, right, let's talk about the first thing first. Okay, what are fibroids? Right, now, if you are male, unfortunately, you're not going to get this issues. This is only woman. Okay, we talk about female disease. Okay, woman's health today. So fibroids is one of my one of you. I can't remember who was it. Let me see. Can't remember. Someone mentioned that fibroids. Can I talk about fibroid? So I did it. I said yes. I may be able to do it tomorrow. So that's tomorrow. She mentioned about last night. So I talk about today and let you know what's fibroids and where do we actually get the acupuncture and acupressure point for fibroids. Now, first we need to know what are fibroids. So fibroids are abdominal growths that develop in or on. Okay, so in or on a woman's uterus. So uterus, it can be grow inside, it can be go outside. There's in or on uterus. Okay, depending where it go. Okay, so sometimes these tumors, fibroids is a tumor, right? This is benign tumors. It's not like cancer. Okay, it's different, right? tumors become quite large and cause severe abdominal pain and heavy period. So it can cause heavy period and abdominal pain, and depending how big is it actually and where it actually develop, right? And it's one of the bigger reason that for infertility as well. In other case, they cause no signs or symptoms at all. So if it's very small and it's not in a very major place, so you don't normally get any symptom. It's very small, okay, and it's just a few of them. It's not a big deal, and it won't cause any signs at all. Right. So the growths are typically benign or non-cancerous. Okay. So the cause of fibroid is unknown. Unfortunately, no one knows where it comes from, according to Western medicine. Okay, but in Chinese medicine, we have a say about it. We have our theory and how it developed. All right, this in Chinese medicine. So fibroids are also known by the following names. So one, myomas and line myomas or uterine myomas and fibromas. Okay, according to the National Institute of Health, which is NIH, so about up to 80% of women have them by the age of 50. What is the age of 50? It's about menopause time, right? Menopause time. However, most women don't have any symptoms and may never know they have fibroids because they don't have any symptoms. And the period, like, it's not a heavy period and it's not unstopped period, so they didn't even realize that they have fibroid, right? It's common. It's common. So again, what causes fibroids? Unclear. No one know about it according to Western medicines, but several factors may influence their formation, right? Like hormones is the first thing, like estrogen and progesterone are the hormones produced by the ovaries, and they cause the uterine lining to regenerate during each menstrual cycle and may stimulate the growth of fibroids. I've seen patients who are pregnant, and as the pregnancy, the progesterone produced, and then as the progesterone produce more and more, and the fibroid grow at the same time with baby grow. Okay, so it becomes dangerous at that point. Sometimes you just need to, if the baby grow faster and the fibroid doesn't grow as fast, and that's okay. If the fibroid goes very fast and you carry a fibroid in a baby, if the baby hasn't got enough space, or the fibroid actually compress the baby, and that may become dangerous. Okay, and again, depending on where the fibroids grow, well, the position. Okay, family history. Okay, fibroids may run in the family. Okay, if your mother, sister, or grandmother has a history of this condition, you may develop it as well. You may not. Okay, so may or may not. Okay, pregnancy. Okay, why? Oh, I just mentioned that pregnancy. So why pregnancy more in risk? Because pregnancy, you increase the production of estrogen and progesterone. Okay, in your body, fibroids may develop and grow rapidly while your pregnancy. Yeah, so that's pretty common actually. If you have fibroid and you got pregnant, so normally what happened is we treat infertility patient. So if they check out they have fibroid, if it's a small one, you don't normally get them to remove them. All right, so we try to use acupuncture and Chinese herb to get rid of it. Okay, so who is at risk for fibroids? Of course, we just talk about pregnancy. Yeah, pregnancy woman. Okay, a family history of fibroid, right? Age of 30 or older, right? Any woman above 30 years old. African American, right? A high body weight. Okay, let's talk about what are the symptoms of fibroid. The symptoms will depend on the number of tumors, the fibroids, how many do you have, and where it actually located, and the size, how big is that, right? So how many, the more you get, the symptom will be more severe. The size, the bigger you get, more severe. And location, some location is not very good for them to grow because it actually avoiding you get pregnant. So it's, yeah, depending where it grow as well. For instance, it most of the time the most common thing is you get period, unstopped period, like heavy menstrual bleeding, or and yeah, another thing is have trouble to conceiving, having a baby. So symptom of fibroid may include, we talk about bleeding, right? The bleeding can be between the cycle, between your period cycle, or while you have your period, okay, during your period. That includes blood clots. It can be a lot of blood clots, okay, and pain in the pelvic and lower back, pain, right? Pain over here or lower back, okay. So the acupressure point that we gonna talk about, show you, it is very good for those pain, right? It may not be able to stop the bleeding, to be honest, because the bleeding is caused from the fibroid. We need to get the fibroid removed or shrink down, and then the bleeding will get better and better. Okay. Increase menstrual cramping, which is the pain. Increase urination, because when it's big, it compresses the bladder, then it make you go toilet a lot, easy, often. Okay. Pain during intercourse. Okay, pain during intercourse is one of the symptoms as well. Now, pain during intercourse, it can be what is it? Endometriosis as well. Okay, so menstruation that lasts longer than usual. All right, we talk about that. And pressure or fullness in your lower abdominal, swelling and enlargement of the abdomen is very big. You can actually see it. It's not fat. It become bigger. I've seen some patients have as big as, no, bigger than tennis ball. Yeah, that's actually quite big. Okay, now let's talk about where do you actually go for acupressure point or acupuncture needle for it. Now, acupressure point, you need to go to, from here to here, halfway and halfway. That is what? Quarter, right? From quarter to here, and that area. So from here, quarter to here. So you need to press anything along here. Anything along here. If you're an acupuncturist, those 3 meridian and between meridian as well. So you need to go define point, and when you go over the wrist, you come to here as well, because that is so important over here. Those are very important too. Okay, those points are quite important. If you use your knuckle, because you have to press hard and deep over here. So normally I suggest use the knuckle to press it, and if you find any tenderness spot, and give it about 30 seconds or 9 seconds or even up to 1 minute. Okay, so along here and up to here. Okay, all this area. Okay, for acupuncture, you get the sensitive point, put needle along here. Okay, Now, if the fibroids are growing bigger, then we need to increase the area, need to come to here, right, rather than just here, right? So you can put needle there, you can massage it. So it's so simple, okay? So those are the point, the acupressure point that you should do if you have a patient that who suffer from fibroids, or if the patient, if you suffer from fibroids, even just a little bit, it doesn't cause anything yet. It's just a bit of uh, irregular period, prolonged period. So you have a test, you have an ultrasound, and they found out this, and they say, well, it's not that bad yet. Let's have a look. Came back in 3 months or 6 months, or if it's bleeding, you can't control it, and you let me know, you come back. That's something that you can do. Massage over here every day. Get rid of those sensitive points. The best thing is get to your acupuncturist, because what happened is we can put needle over here to help the fibroid to pass out the fibroid, and it's possible. Okay, it's possible to pass it out, and of course it depends on how big is that. All right, how big is the fibroid? All right, and if you want to avoid the hysterectomy, so acupuncture and Chinese herbs may be a way for you to prevent that. Okay, so not 100%, but it's possible. Right? Stay awesome, and I love you all. I'll see you tomorrow night. Bye bye.